Wanda Wood, appointee, El Paso County.
Bob Foster, Teller County appointee. Kent Matthews, at large.
Bill Stafford, at large.
Paula Levy, Chair, Colorado Springs. And we'll move to the people online. And I see Steve.
Good morning, Matt, or good afternoon, Madam Chair. Steve Schleicher, El Paso County Representative.
And it looks like we have a guest. Phyllis?
So Phyllis is Penny Everest
Oh,
for Park County Senior Coalition.
Thank
Sorry,
you,
I gotta
Penny.
change that.
thank you. And I know Penny number 2 was going to be joining us online. So I expect her shortly. And that's all that I know of. Melissa is not with us today. Jared is not with us today. And it looks like Jody is not with us today. So bear with me because I'm sitting over here all by myself. Oops. Yeah. Okay. Could you roll up the agenda for me, please? Right. We need a motion to approve the agenda as presented.
Bill Stafford, I move.
Bob Foster, second.
All right. All those in favor of approving the agenda as presented, please say aye.
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 Motion carries. Agenda has been approved. Next is consent items. And that would be the approval of the minutes from our January 21st meeting, which should have been in everyone's packet that we received. And I need a motion to approve those minutes from the January 21st meeting.
Kent Matthews, I move that we approve the minutes from the January 21st, 2026 meeting.
And is there a second?
Penny Everest, Park County Senior Coalition, second.
Thank you, Penny. And all in favor of approving the minutes as presented, say aye.
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 Thank you. That motion carries unanimously. Next, we'll move on to item 4, public comments and presentations. And I don't think we have any.
We didn't receive any online or in the room.
No. Thank you. All right. Next is presentations. And I don't know, Steve, is this where you're going to share your information?
Certainly, Madam Chair, if you want me to go ahead and discuss the 2 bills that we've been talking about.
I think this would be a good spot since I don't have anybody to tell me it's not.
Okay. So Phil, feel free to jump in at any time, sir. But we have been looking at several bills that could possibly affect what we do as board members with the Commission on Aging. So the first one is Colorado House Bill 261001, which is the Home Act. And what this basically talks about, it requires certain local governments, population greater than 2,000, to allow residential development on qualifying properties owned by specified nonprofit or public entities through an administrative approval process beginning December 31st of 2027. So some of these qualifying properties would be, public-owned properties such as school districts, any kind of county-owned land, municipality-owned land, nonprofit land, things like that. But Madam Chair, I went through and, read through the bill and, identified some potential benefits, pros, and also some potential concerns regarding this bill for the board. One is, the first pro is definitely increased housing supply. The second is streamlining the approval process. Third, the intent of the bill is a supportive community uses. So if permitted within existing zoning developments, may include childcare and certain community serving uses which can support aging population and caregiving needs. The other one is potential property tax growth, because when you're going from vacant land to improved land, the value of that parcel certainly does go up with the improvement. And the fifth pro that I can see from this bill is preservation of safety and infrastructure authority. However, some concerns is reduced local zoning discretion, limits on local standards, height and density constraints, administrative burden, increased workload for local governments to establish or modify administrative review processes, and also infrastructure pressures. Why counties retain code authority, additional residential development may strain roads, emergency services, water systems, and wildfire evacuation capacity, which we all know, for those of us that are in the WUI up against the mountain, that is something to be, considered. What I also did, Madam Chair, is I looked at county-specific considerations, because I know we sit there and represent not only El Paso County, but Teller County and Park County. But El Paso County has a greater likelihood of qualifying properties due to our population size and the presence of public nonprofit landowners. Potential for increased housing production, including near transit corridors, and must manage growth impacts while preserving wildfire and infrastructure safeguards. Teller County and Park County, I look at them both almost the same, because many rural parcels may qualify as exempt due to septic or well service. So a lot of those properties up there they would not be able to fit within this bill because of the septic or well service and limiting overall applicability. And where domestic water and sewer service exists, the bill may reduce zoning flexibility. My overall assessment that I would like to share with the board is House Bill 261001 aims to increase housing supply through state level land use preemption focused on nonprofit and public land. For aging services, it could support workforce and senior housing opportunities. However, it reduces local land use discretion and may create administrative and infrastructure challenges, particularly in rural counties. The practical impact will vary significantly by county, with El Paso likely experiencing the greatest applicability and Teller and Park potentially more limited due to exempt parcel definitions. So I just ask, are there any questions from the board or from the chair regarding the highlight of this House bill? And Madam Chair, if I'm hearing none, that must have been amazing.
So
You were so thorough.
Steve,
We're just all speechless.
Steve, this is Kent Matthews. I have a question about what's the percentage of rural versus urban in the state of Colorado?
Oh my gosh, that is a very good question. I will tell you there are far more counties that are rural than actual metro, but I can get that information for you through the Division of Property Taxation.
Well, I was just asking because based on your summary and your conclusion, the bill that we're talking about seems to be more favorable to metro areas rather than rural areas. So just on that factor alone, when it goes to whatever vote may be, those in rural counties may not be as amenable to the bill as those in metro areas.
Correct. And the other thing though too is, I mean, a lot of folks will sit there and look at El Paso County as a metro county, and we're very diverse. We have a lot of rural and we have a lot of vacant land here in El Paso County, especially, down in Fountain, Monument, Palmer Lake, out east, that is on well and septic, and those parcels would be exempt from this bill.
Yeah.
Yep. Great question.
Any
Madam
other
Chair?
questions? I see that Penny Whitney has joined us, and so has Carolyn. Any questions from you? Ladies?
this is Penny, Penny 2. Steve, helping me sort of frame this, what do you think, or if you could just state what the intended purpose of this would be? I know you gave the value add, the other considerations, but I really respect your professionalism and experience in this. Do you have sort of a Cliff's Note summary to help some of us that aren't quite so knowledgeable in this area, just what the gist might be for us to consider?
Penny, absolutely. In fact, I could definitely share this with Melissa and Jared to share with the whole entire board. But I do have cliff notes and just a summation of the highlights of the bill.
Because I think one of the dangers, and I was just on a conversation with a gentleman from a rural area in northern Colorado, that so many of the issues that come for legislative decision are specific to certain areas and don't have a broad understanding in others. And the implications could have far-reaching impact. And that conversation and your presentation really has made me realize that there is a due diligence as a voter that we need to exercise. And this is one of those areas where I would really appreciate that sort of guided assistance in understanding the implications.
Yeah, and Penny, Phil, I, and Melissa, we met last week talking about these very two bills. And Melissa was very direct in some of her questions in regards to how should we sit there and present this not only to the board that you and I sit on, but also to the PPACG board, where they're sitting there, not understanding. But the three of us felt it was important to bring this to, our board, the Committee on Aging and stuff, just to sit there and share that this could have some impact. But the pros and cons, and Penny, that's one thing that I'll always do, and I will most certainly share the summary notes with each and every one of you.
Thank you, because I think there is a responsibility for us as individuals to do due diligence, even in those areas that it's harder for us to really get the essence of the picture. So thanks, Steve.
Yes, ma'am. Absolutely. Hey, Phil, are you okay if I continue moving forward with House Bill 261018?
Yes, Steve, please do, and thank you for your work on this. Before you move on, your number 4 of potential property tax growth. I found it interesting in our meeting the other day, mentioning that some of the churches and such that are currently tax exempt might not want to participate in this due to the fact that they would be taxed.
That is correct, Phil. So if a nonprofit who has sought exemption through the Division of Property Taxation, because they have to submit an application which is approved by the DPT, if they are generating any kind of revenue outside their application, then they lose their entire exemption. That's a big hit to some of these nonprofits, and they have to be extremely careful when doing this. So those are things that I feel, some of these nonprofits will, definitely look at because they most certainly don't want to sit there and lose their exemption where now they become fully taxable.
Yeah, that's a very good point. And then, yes, please, if you would, move forward with 1018.
Okay, thanks, Phil. So, Madam Chair, we also discussed, and this actually was heard in the Health and Human Services Committee yesterday. So House Bill 261018 creates a Medicare presumptive eligibility pathway for long-term services and supports LTSS for individuals transitioning out of nursing facilities contingent upon federal authorization. So some of the key provisions of this bill, this is one that Bill and Melissa and I talked about in depth. So the key provisions, the state must complete a functional eligibility assessment within 1 business day of notification of a planned discharge. If criteria are met, the state deems the individual presumptively eligible and notifies the county. The county must enroll the individual in LTSS within 3 business days of notification and may not conduct a financial eligibility determination during presumptive enrollment. Required services must be in place before discharge. The bill includes accountability measures for counties and nursing facilities and requires annual reporting. Reporting references local support agencies, including Area Agency on Aging Centers. The fiscal note anticipates implementation costs and projects long-term savings through reduced institutional utilization. So, Madam Chair, as I shared is, again, if I could break it down, potential benefits and also potential concerns. Some of the benefits that I see are 1, faster, safer transitions to community living. So it ensures long-term senior services and home-based supports are arranged prior to discharge, reducing delayed or unnecessary nursing facility stays. 2, increased access to home and community-based services. 3, alignment with aging in place goals, which is basically a goal each one of our board members supports. Number 4, accountability and oversight. And then 5, potential long-term cost savings. So potential concerns that I have with this bill is significant administrative burden on counties. Counties must complete enrollment within 3 business days, creating operational strain, especially during staffing shortages. As we know, and this is not happening in El Paso County, but most counties are budget strapped, and many counties are now being furloughed or laying off staff. And we're probably seeing that right now in the local news media that Pueblo County is in a $10 million deficit and they are laying folks off. Number 2, limited county financial review at enrollment stage. Counties are prohibited from conducting a financial eligibility determination during presumptive enrollment, potentially raising program integrity concerns. 3, escalation mechanisms may reduce local control. Repeated failure to meet timelines may trigger transfer of responsibilities away from the county and go to the state. Number 4, rural service capacity constraints. Even with expedited eligibility, availability of home health providers, personal care workers, transportation, and accessible housing may limit practical implementation in rural areas. And 5, and lastly, implementation and legal risk. Fiscal note identifies significant implementation costs and potential interaction concerns with the DOJ settlement agreement. So as I did, colleagues, is if I could break it down by county specific, looking at El Paso County, again, just because due to us being who we are, is the likely highest volume of nursing facility transitions. Increased workload for our Department of Human Services enrollment staff, and also greater provider network may ease service placement but require strong coordination. Teller County, lower volume but more vulnerable to staffing and provider shortages. Tight timelines may be difficult given limited workforces and geographic spread. Park County, very similar rural service capacity challenges at Teller. Transportation, housing, and home care availability may delay practical service start dates despite eligibility approval. So my overall assessment on House Bill 261018 is it supports the policy goal of helping older adults and individuals with disability transition safely from institutional settings to community-based care more quickly. For aging services, this aligns strongly with aging in place objectives. However, implementation places strict timelines and administrative demands on counties, and rural service capacity may be a limiting factor in Teller and Park counties. El Paso County may face the largest volume impact, and this bill certainly represents a policy shift towards faster institutional discharge and stronger state oversight with both system-level benefits and local operational challenges. And Madam Chair, that is all I have.
Thank you, Steve. Are there any comments about last bill he just discussed.
This is Phil Stafford. Kent and I were just whispering back and forth of the bill itself has some limitations due to, especially up in Teller County, there's no home cares up there, and the lack of resources once people are moved out of these communities where back to home where they want to be, but there's no resources for them when they're home. So that could be a strong operational challenge.
Well,
Bill,
along those same lines, there's not rooms available once they're discharged in care communities. There's just not capacity to take on these people that are discharged. So it's not as nicely laid out as it seems.
This is Kent Matthews. One of the practicalities, Teller County, Woodland Park has home care agencies, but they're all based in Colorado Springs, and they go up to Woodland Park. They may go into the Florissant area depending on where the person is living in Florissant. But other than that, there's difficulties in areas like Victor and some of the other small towns up in Teller County. And Park County, they get some home care service. I think it's up in the Fairplay area close to Denver. There's some home care agencies that come out of the Denver area up to that part of Park County. But other than that, that's a desert as well. So the practicality is it's enacting that in the rural counties, especially the ones that we're familiar with, is going to be a challenge. And even in El Paso County, going back to what Steve had said before, you start getting out into, like the eastern parts of El Paso County, past Calhan. I think Calhan is like the outer limit. You start going past that, you're not getting home care companies out there either.
Madam Chair, this is Penny. What I found with a lot of seniors and what's happening now is their relatives are shopping the counties for senior services and before they move anybody anywhere, which is, I don't know if that's odd or not. But yeah, in fact, I just had somebody else who just called and said, I've got a blind woman that's 84 years old that needs help. What can we do? And I'm just like, there's very little services. There's Home Instead, care.com, Visiting Angels, but it's very limited. And it's a real shock to some people that we don't have as many services like Teller County.
Right. Well, and I can speak to the day program I had for 7 years up in Woodland Park. We had several of our participants came from El Paso County. We had participants that came in from Park County, and we even had a gentleman for 8 months whose family drove him from Evergreen into Woodland Park twice a month to attend the day program because there wasn't that type of service for him in that area. So the need is tremendous for services of all kinds. And people will search and research and drive for quality care.
This is Bob Foster. After I was on for the last part of the meeting that Steve was talking about, and I was totally ignorant of what was going on other than a few things that I had heard. So when I got back the next night, I called Kathy from Teller County Senior just to ask her what was going on. And she said, I would even take it a step back. She said, we've got 3 clients right now who went in for surgery and the hospitals kick them out faster than they probably should. That's not an objective, but what she said, and they get home and there's no health care for them at home. And the very next day they're back in the hospital again. And so it maybe begs that we should be putting something into our legislatures to say, hey, the whole home health care needs to come in a bill before we start talking about discharging anybody anyplace. And yeah, on all levels, which then made me think of the first time I came here and I picked up a flyer about somebody in El Paso County starting a program in high schools to try to train and attract high school students into healthcare, which I thought maybe that's something that we ought to really get behind at the root level to help try to solve, or at least throw it back to the state that they should be, that they're kind of coming at it from level 5 and they need to go back to level 1 or 2 to try to build something.
Penny Whitney, do you want to speak to that a little bit?
Bob, that is absolutely right. And I have been involved with Kent on exploring with high school students and home health providers the potential fit between certainly age appropriate and having students understand the work of home health, and actually in Fountain, because they're faced with a similar situation that they could use more home health providers there. And JAWS has a very strong relationship with Fountain Fort Carson. I think that I really support the idea of looking at a systemic problem and identifying who are the players that are currently there that could help support maybe not the entire solution, but at least be players. And it's students, young people that are interested in healthcare. It's the older people that live in the communities that could also help provide part-time respite, home health, short-term home health support, long-term home health support as a career. But I would absolutely fall in step with you to identify that as an important area of advocacy.
Anyone else? Oh, Steve.
Yeah, so Madam Chair, and only if Jared is good with this, because he provides us amazing legislative updates, just because of the business I'm in, I'm constantly tracking every single bill. And if Jared and Melissa and if the chair are fine, is I have no problem, tracking bills that have an effect, on the Commission on Aging, and provide monthly updates as to how things are going and provide updates to the board, if you're okay with that.
Well, Jared's not here, so I think we can do whatever. So, I'm saying so, because there's nobody here to tell us to do anything different. So I would say, go ahead, Steve. You do you. Okay. Great. Now we're going to move on to information items and membership committee. And Steve, have you taken that over?
Yes, I have, and I did have an amazing meeting with 2 of our newest members, with Melissa. And so I too am just catching up. And once Melissa comes back, she and I are going to schedule a meeting with one another just to see, okay, what do I need to do to get other folks to represent our other communities here on the Commission on Aging. But that is where we are at right now, Madam Chair.
Great. And how did the orientation go last week? It was Marilyn saying it was great. Great.
Yeah, a lot of
Super.
great questions, and their introductions were amazing, because I'm sitting here going, where were several of you when I was out doing town halls to many of our seniors about the new clerk and recorder program regarding property fraud? And a lot of our seniors just needed help with technology. So I was like, where were you guys today when I was out there?
Right. I just am amazed at the quality and caliber of people we have around the table, because it was not here when I started on the commission, and I just counted 12, at least 12 commissioners now, and we were not this strong before. So it's exciting. Thanks, Steve. Jurisdiction reports update. I don't know that we have that. Colorado Senior Games update. I don't know that we have that. We will have updates next meeting for sure. The policy committee, Colorado Center for Aging. I don't know if we have, oh, here we go. We have this bill that is in front of us now on screen concerning senior cooperative housing projects. So I could just, so real property or buildings used to provide dwelling accommodations that substantially benefit persons with low income property or project property that is owned, leased, or under construction by a local housing authority or an entity that is partially or wholly owned by a local housing authority is exempt from property taxation. Section 1 of the bill clarifies that a senior cooperative housing project may qualify for such property tax exemption as a project of a local housing authority. A senior cooperative housing project is defined as a multi-unit residential building or complex occupied by qualifying seniors that is owned by a cooperative or a cooperative housing corporation. A qualifying senior is an individual who is at least 65 years old and of low income. The affordable rental housing component of the property in a public-private partnership between the Middle Income Housing Authority and one or more public or private entities or persons is exempt from the property taxation. Section 2 clarifies that a senior cooperative housing project that otherwise meets the qualification and is selected by the authority may qualify for such property tax exemption as an affordable rental housing project. Senior cooperative housing project has the same meaning as in section 1A. Qualifying senior also has the same meaning as in section 1 and includes an individual who is of middle income. Note, this summary applies to this bill as introduced. And it was introduced 2/11 of this month. Any discussion on that bill pending? Hearing none, we'll move on to the Pikes Peak Area Council Government Legislative Committee, and that just keep popping things up. Okay. So housing, okay. Okay, so we'll just go through. Okay. All right. So Colorado Commission on Aging. Penny, do you have anything on that?
I have one thing that I would like to pose to our Pikes Peak Commission. I do the Professional Advanced Certificate in Gerontology program for UCCS. It's a facilitated program, 2 semesters, for primarily adults that are working in professional spaces that interface with older adults, and perhaps the individuals don't have an extensive knowledge of older adults, either through academic courses or other experience. And our leadoff speaker for the spring semester was Christine Burrows, who's with the Colorado Commission on Aging. And really a key point of her presentation was the multi-sector plan on aging, which is a 10-year roadmap for Colorado, looking at how do we integrate awareness, services, and quality of life for an increasingly large demographic in our state of those over 65, and particularly for those 85 and older currently. One of the things that came up in the conversation was the importance of regional, local areas to take ownership of the multi-sector plan in their area, realizing that for the state to try to keep track of all of the regions within the state, be familiar with what the specific needs are, is totally unrealistic. So during our conversation, the thought popped up, would oversight, or just not ownership really, but stewardship maybe is a better word, for the multi-sector plan on aging, could it be well placed in the Pikes Peak Commission on Aging? For some good reasons, I think. First of all, we represent a tri-county area. Park County, which is certainly rural, probably in parts that verges on frontier. The Teller County has certainly parts that are rural. And as Steve said, Eastern Colorado. And then we have a metropolitan area. So I think the diversity and the opportunity for our group to get input from these different constituencies might be helpful. The other thing that really came out that was sort of interesting out of this program group was that as they have discussions, and these are people that work in fields or have interest about looking at volunteer opportunities, transition to work in areas that focus on older adult, that there too may be some ideas that could be suggested for the multi-sector plan. So I guess, and the work I do with high school students, and certainly partnering with UCCS, the opportunity to include an intergenerational voice. The question I would like to put is, do you think it would be worth consideration of sort of saying, yeah, we will continue to talk about the multi-sector plan, contribute ideas, look at areas of the 5 pillars as they specifically relate to our community. So if there are any thoughts or discussion on that, that would be what I would like to take back to the Commission on Aging as, yes, our community would be willing to actively be a partner in the development of the multi-sector plan on aging. But certainly your input is necessary and essential for me to make that kind of statement. So thoughts?
Absolutely. I think that is something we would definitely support, the intergenerational connection, as you know, and as I know through day program, and that is something the new day program is really leaning into. Hopefully the building we're looking at is located right next to a preschool, and so the opportunity for intergenerational connection will be a daily occurrence, which is if anybody has seen what that looks like in a adult day program with individuals living with brain change. It's absolute magic with those little kids and those people living with brain change. So really excited, and I've seen all ages experience lots of magic with intergenerational connection. So I would absolutely support that, Penny.
Okay. Thank you.
Anyone else?
I would be particularly interested in hearing thoughts from Bob and Penny, because they represent the two other counties that the Pikes Peak region consists of.
Well, as far as like intergenerational and having the Boys and Girls Club and the school come over, we do a lot of things with the seniors during the brunch. As far as we wanted to do like yard work for them and a whole bunch of other things, and liability kind of stood right in our
Yeah.
way.
Yeah.
You know, we had to do the CBI reports and everything else, and we just thought, no, there's too much cost involved. There's got to be a better way. So
Yeah.
that was very frustrating.
But some of the work you do with the interaction with the brunches and that sort of thing, I think those would be important things to share with the rest of the state.
Oh, yes, definitely.
Okay. Bob, any thoughts?
Yes, this is Bob. Again, I've got more ignorance than I have knowledge. I'm not even sure what the whatever the term
Oh,
was,
good.
program is. I may have seen it. So that's where you kind of, left me. We're talking about something, and then you said, well, now say something about it. The only thing that I can say is that the one organization that I started working with, and is my only, other than being a senior, the only real experience I have is being with Teller Senior Coalition, is that they reached out to us. We have one grade school that's located about a mile from our headquarters called Summit. And the principal there is one of the most innovative women that I've ever met in my entire life. And she reached out to us, and we started out just with a reading program. She felt that it was not from the seniors, but from the kids' point of view. She felt that she would like to have her kids be around some older people other than their parents. And so we got about 25 seniors
Oh my
to go
gosh.
to their school and read and they brought in a whole classroom and would bring 30 kids in to read to 30 adults and et cetera. And then we had lunch with some of the people, et cetera. All that has gone on to where we said, well, what else can we do? And so they did a food drive. And this was before the SNAP program. This was even last year. And so they got the kids to find out, well, what kind of food do seniors eat as opposed to what we like, et cetera. And so they did a food drive. And then we decided that I can't remember which one of I think it was one of our drivers went by the school and was appalled at the footwear that kids were wearing in the snow on recess, and saying, and so we did some inquiries and found out that there were a lot of low income kids who couldn't afford anything other than Crocs or tennis shoes out in the snow. So the senior coalition raised about $7,500, and we went out and
Oh my
bought
gosh.
shoes
That's wonderful.
for and et cetera. And that's in its third year. And but anyway.
Oh my
So
gosh. Those are the stories I think that we could tell. I
Definitely.
love it. Oh my gosh.
well, okay. So if that's what you're talking about, I'm all for it.
Cool.
But as far as, so I would love if somebody could get me what this plan is that we are talking about, but that's what we have done. I will say from Teller County, and just about everything that I hit in this room, is that when it comes to Teller County, our problem with seniors is getting them there. And our primary thing with the Teller Senior Coalition is transportation. But we are strapped trying to get, because our funding all comes through this higher organization that and CDOT, but they have restrictions on what they will fund transportation wise. And so if we want to do bus routes, we've got to raise that money outside of this. But we don't have enough money for, I mean, there's a demand for more vehicles and more drivers, and we could probably get them. We just don't have the money to do that. But
Yeah.
anytime you're talking about intergenerational people getting together, then the seniors said, I'll come, but you need to pick me up. And so to get any kind of participation, I'm sure in Park County, it's the same way, that that if they're fortunate enough to have good health in their senior years, and even if they have good health, they sometimes may not want to drive with the type of drivers we have going out Highway 25 and Highway 24. But anyway, so that's a real problem, is it? And I'm not saying that here in Colorado Springs, but you have a bus routes and you have a little bit better transportation possibilities down here than we do, at least in Teller County. So
Penny, I want to let you know one more thing. I'm
Yes.
working with Abby Schmidt from CSU, the 4-H. She's
Yeah.
the head of it, and we're trying to come up with some programs to, mix the kids and the seniors too. So we're putting our heads together and trying to come up with something.
That's great. Paula, if I would volunteer to do sort of a synthesis, because Bob, I'm pretty sure you're not the only person that the multi-sector plan on aging just doesn't pop immediately in your mind. So I would be willing to do a synthesis of what the pillars are and just a short summary of what's the purpose of this thing. Because I do think this sort of practical example is what they're looking for.
Sure.
And I think I actually have very strong reservations about anything that's done with a 10-year window, that it's going to stay alive and well and valuable during that course of time. Unfortunately, too often they just get shelved. And so I think we do have an opportunity to lead the state. So if next month there would be a short agenda time during the Commission on Aging, I'd be happy to work with Christine and get the slides for a short overview.
That sounds great. That sounds great. And Carolyn, I just asked if we could get you unmuted. So we're working on it. I'm sorry. You should be able to talk now, Carolyn.
Should be able to take yourself off mute.
There you go.
There you go.
I can now. Thank you so much.
Did
All
you
right.
have something to say about the senior games?
Oh, I can tell you plans are moving forward. In fact, there is a little bit of a conflict. There's the Senior Resource Council is hosting a mixer next month on March 18th from 4 to 6 at the Senior Center. And it would be, I think, great if we could be represented at that event, but I know it conflicts with this time. So the plans for the games are moving forward, and Melissa and Kim and I have been on calls with the group to try to help get the word out and get some intergenerational participation in the stand to cheer our athletes on. Last year, I think there were over 800 athletes, and they're certainly hoping to increase that. It's what they call a qualification year for the Senior Olympics this year. So it should be a good turnout of athletes, and we're here to support that event.
When is the mixer? I'm sorry, I missed that.
It's March 18th. I just saw the meeting notice come out about an hour before this meeting. Sorry, I was traveling, couldn't get back in time.
That's okay.
But it's at the Senior Center on March 18th from 4 to 6 p.m.
But like Carolyn said, it conflicts with.
It does, yeah. So maybe we could talk real fast or meet in the parking lot over there.
Yeah, I mean, we've talked about moving our meetings around
We
the
did,
area.
yep.
Maybe that would be an interesting place to
That might be, yeah,
host our meeting, and then we could duck out and participate in that.
yeah, absolutely. Well, talking about all that intergenerational thing, I just want to share this, and it's a video, but I think you'll get just as much out of it just listening to it. And it was one of the Steve Hartman's stories on news. No, this is on the the daycare across the street, but I just want to just play this story because it just really spoke to me. So hopefully you can hear it. Let's see.
Stop doing this. Let me show the biggest iPhone mistake made by old people. You should always use.
Madam Chair, this is Carol, and that's a beautiful story. Thank you for sharing it. And I also wanted to add in my support for really just taking on that multi-sector plan. And it made me think, I wonder if, as we talk about different agenda items or different bills, it wouldn't be helpful to just put in parentheses, like what element of the plan that supports. Might just kind of help keep us aligned with the different initiatives.
That's a great idea, Carolyn. And Penny, I don't know if we could get it on the agenda for the next meeting. What do you think?
I think, yeah, I think we
Okay.
could. Yeah,
Let's plan on it and we'll
excellent.
see. Okay. Great.
Excellent, thanks.
Yep. All right. So we don't have a director's report from Jody, and my chair report. We'll just keep moving on, and we'll move into the work session updates, and we'll start with the age-friendly housing and transportation group. You don't have anything? Okay. the Caregiver Supports and Services Group.
We meet tomorrow.
You meet tomorrow. Okay, super.
So next month we'll have a report from that
Okay,
meeting.
perfect. And the Social Engagement and Inclusion. Kathy, anything?
Most recent thing is that we found out the mobile home park is being sold. And the closing's supposed to be next month, but I'm gonna get the name of who it's being sold to, and see if we can connect.
Okay, great. Thanks. And I just see we discussed the discussion items earlier in the meeting. So there you go. Any member entity announcements anyone would like to share? Anyone? Anything from Hey Neighbor, Marilyn? There you go.
We're
Did you
getting
say-
ready to
I don't
launch
think
our
that's me.
100
If you said
Okay.
Carolyn, I'm sorry.
No, I said Marilyn.
Oh, good. I'm sorry.
It's okay.
We're getting ready to launch our 150 tables initiative. And so I'll be getting information to all of you, and we want to do it not only in neighborhoods, but in community centers and assisted living or wherever. What it is going to bring people together at the table for a meal,
Awesome.
just for connection. And so we would be interested in having young people involved in that too. So I'll be bringing more about that.
Great.
Thank you.
That sounds wonderful. Thank you. Phil?
Madam Chair, this is Phil. I just wanted to, on the schedule was advocacy that Melissa asked us to talk about.
Oh, yeah.
Did we want to postpone that with the limited of folks here or discuss that?
We can discuss that. Do you want to lead?
She had asked me about that, and I guess by definition, advocacy, the act of pleading for, supporting, or recommending. I always reflect on healthcare. Most of my career was in healthcare. In healthcare, advocacy means promoting the desired goal of a person or a group. Health advocacy promotes your right as an individual to make medical decisions that align with your beliefs and personal goals. So that takes it down to the personal level, but more for the Commission on Aging and a higher level look at that, which I think is what Melissa wanted us to do. Public support or a recommendation for a particular cause or policy. So I think that's where we would fall in as the commission. And just wanted to make sure that that was discussed because it's on the agenda.
Thank you. And the question that was posed in the discussion items was, what does advocacy look like to you? And I'm sure it looks different to each of us. So if anyone wants to, yeah, Wanda?
I put advocacy to me as influence, using my voice to create opportunities and protection for others. I think when she asked us to think about this question, at first it was like the simple answer. You gave a very in-depth, layered answer. That was great. But it made me kind of think about what it really is. And so that's what it means to me.
Anyone else?
I'll say, to me, advocacy is hearing from and speaking on behalf of people who may not be in the room or at the table.
It's great.
And I guess to add to that, those that can't self-advocate.
Bob?
Yeah, this is Bob Foster. To me, it's got to have a context of advocacy. If I'm sitting in this chair today, I'm advocating for seniors to whatever the vision and the mission of this council is, which I was looking for it, and I left those books behind. So I can't tell you what it is, but that's what I should be doing, is advocating for senior in light of the mission statement that we have, or our vision statement for what we want for seniors. If I was sitting in another room in a senior nonprofit, I'd be advocating with their point of view. I'm sure a state legislature would have a whole different view on what advocacy is, because they get tired of all the advocacies that are going. But I think that whether we're talking about roads or transportation or housing or anything else, it's always, I would not want to talk about, yes, I guess I have a personal view, but it's a personal view that is filtered through what the mission and vision this council is. And that if I want to go outside of that, then I need to get out of my chair and go to another room that would have that as its focus. But and if I'm sitting in my Teller County Senior, it's to help seniors age with independence and dignity. And of course, that's very broad and et cetera. And so when we're talking about some of these bills, I'm saying, what can I do so they can stay independent, which is healthcare. I mean, to get healthcare, home healthcare for them, so they can stay in their home, because hopefully they'll have more dignity, and it'll also cost all the agencies a whole lot less money to keep them there than put them in any place else. And so.
Great. Kathy, do you have any?
Yeah, well, I just wanted to say there's individual advocacy. So you're advocating in behalf of one other person, or there's systemic. And that's what we're doing. And we're trying to pass things that are going to help many people. And I think that's the whole thing, is you're just trying to help everybody.
Anyone online want to chime in?
Hello, this is Carolyn Castan again. I think she's also maybe talking about how we advocate for some of these legislative things that impact the seniors, right? So how do we add our individual membership voices to maybe the voice of the coalition? I go back to, I think Penny, though, made a comment that we need to do that due diligence as individuals. So when we were talking about the bill about the presumptive approvals, I felt like the piece that was missing that I need to go back and do due diligence on is, what is the provider perspective on this? You know, what are the nursing homes feeling about this? Because I think we have to kind of pull all of our collective expertise and our backgrounds together to make really informed positions. But I think that's the other piece of advocacy, just to add on to what everybody else said. Then how do we take that as commissioners and advocate around some of this legislation?
Great, thank you. Pennies? Either Penny? Penny, for your
Well,
thought?
I definitely agree with what everybody's saying out there. Definitely, we have to figure out a way to advocate for the seniors. Just sometimes the avenues don't seem as open as they should be, but something for me to research and push out there in getting the seniors their attention.
Great, thank you.
The word that I would add to everything that has already been identified is responsibility. I think that as a member of the commission, that there is a responsibility for us to use our voices and, as Penny said, identify those avenues and identify opportunities for other voices that we might be able to add to the conversation that actually might have more resonance than our individual voice. So thinking about responsibility.
Great. Steve?
Yeah, so Madam Chair, I guess, what I am looking at is, advocacy means actively supporting, promoting, or speaking in favor of a cause or a policy, a person, or even an idea.
Okay, great. Wanda used a word that I hadn't thought of, was the protection, protect. And I hadn't thought of that word in conjunction with advocacy, but it really does go with it. And as does collaborate and collective responsibility. I mean, all the words you could bullet point, all the words that everyone used and use them in the definition of what we do here. So I think maybe we'll do that and come up with our own definition of what we do as a commission to advocate for the seniors that we represent in our counties. So thank you for your input. Thanks, Phil.
This is
Oh, go ahead.
Kim.
Yeah.
I touched upon this when I spoke earlier, but I want to underscore, emphasize the piece of making sure that causes, the people that we're advocating on behalf of,
Mhm.
because I think sometimes we can be really passionate about something and pursue it without necessarily having the insights from politicians.
Mhm.
So it may seem obvious to all. I just want
Right.
to underscore it.
So hearing the voices that we're, yeah. Yep. Great. Very good. Thank you. Now back to member entity announcements. If there are any more. Anyone? Marilyn, did you have an advocacy? And I didn't mean to skip you over. I'm sorry.
I had it, but then as everybody went around, they all said it.
They all said it. Okay.
But I agree with everything that everyone said, and I
Okay.
especially like what Penny said about responsibility. 'Cause
Great.
that's why we're here. Yeah.
Yep. Thanks. I'm sorry. I didn't mean to not get to you. Okay. Great. All right. Well, if nobody has any other announcements, our next meeting will be March 18th, possibly at the senior center, so we can join the mixer for the senior games. We'll see what we can do about moving the meeting there. And our executive committee meeting is always open to anyone that wants to join us, and that is always virtual. And it's the first Wednesday of every month at 9. And that invite goes out, should go out to everyone. I'll make sure it does. And then the committee meetings are as determined, and the working groups have their set days and times. And I think next month we're going to be presenting to the PPACG board an update of what we're up to. So anyone who wants to stand next to me during that time, I would appreciate it. So, or you could all come. We could all have a party. We could all go out to breakfast afterwards or something. What is that? That meeting is when the PPACG meets, which is the board meeting. When is that? The third, second Wednesday? March 11th. March 11th at 9 a.m. Okay, great. March 11th. We'll just give them a little update about what we're up to. And they'll be impressed with our long list of commissioners. It just keeps growing. Exciting. All right, if there's nothing else, we'll adjourn the meeting at 4:14. Great, thank you, everyone.
Very good. Thank you.
Thank you.
Bye. Mhm.
Bye-bye.